Hi, this is Dr. Jim Anderson, and I'm here to talk to you about plantar fasciitis. And as you can see, I'm outside of our operating room here. We have our own surgical center facility. It's right adjacent to our clinic, and it makes it really nice because we have good equipment and good staff, and they're all really well trained and used to all the things that we commonly do in our profession. But one of the things that can occur sometimes is people that have severe plantar fasciitis, which is heel pain on the bottom of the heel, which would be right under here, and the fascia runs from the ball of the foot back to where it attaches to the heel. There are occasions when we have to resort to surgery, and we don't want you to go in there, and you don't want to go in there, but in some cases I think it's really a good thing, and it's going to help you a lot to do surgery for your plantar fasciitis. So the things that we tend to do primarily to avoid going to the OR would be orthotics, and this is in some other videos. We commonly use orthotics. We do quite a bit of regenerative medicine. I've been doing stem cell type treatments, what we call regenerative medicine now for about 10 years, which can be very helpful. We do something else called shockwave, which is like lithotripsy, which is where you break up kidney stones with sound waves. And these sound waves, when you do this into the heel, kind of traumatize it and help I call it the meat tenderizer, helps your body by traumatizing the fascia, so your body helps to repair the fascia even more, and so that's useful. We also use laser from time to time. So those are primarily, that should be for you got orthotics, laser, stem cell, and shockwave. Those are the primary things that we do. Before you come in here, a lot of people do a lot of other approaches, maybe strapping, maybe using rollers or icing, maybe night splints. Those things can all be helpful, but I don't think they always get you to the end point. Sometimes they can be more of a maintenance thing that you have to chronically keep doing. So we primarily focus on those four things because we believe there's some science behind them to show that it can help repair your fascia. So what happens if you go in here? Well, if you ever have surgery for this, what we do it with a scope, and we make a very small incision on both sides of the heel, right here and then on the other side. So across the bottom of the foot, we place a device that's like a little metal tube, and then within that goes a scope so that we can look inside, and the tube that we place across there has kind of a slot or an opening so we can look up into the fascia, and we only cut the fascia about halfway across. We don't want to fully cut it, but we just cut it, and that allows it to be released. Sometimes it's as little as a 15-minute procedure. You're able to walk the next day, you're showering within a few days, and usually the layup is 2 weeks in a removable cast, walking immediately, and then another 2 weeks after that, you're gradually transitioning out of the removable cast. But very high rate of success, but again, very few people get to that point, but I just want you to know that we do it. And one of the things I always like to tell people when they first come in, there are people with plantar fasciitis right now, probably somewhere in America, that rupture their fascia. They had heel pain, maybe they're out playing tennis, they heard something pop or snap, and it ruptures from their heel. And with very few exceptions, if it has a good rupture, they come in, we put them in a cam boot, and almost without exception, they do better. They don't need any treatment, because in another way of thinking about it is Mother Nature took care of it. Mother Nature actually stretched out their fascia. It just scars back together, it's longer, it's not as tight, and their pain's gone away. So that's sort of Mother Nature's way of correcting it, but seldom does that do that. So I don't recommend you go out and play real hard tennis if you have heel pain. It probably isn't going to happen. So that's really it. So I hope you're enjoying this content. Please comment if you have any questions, and by all means, please consider subscribing and just click the subscribe button, because we'd like to have you join us and keep learning more about foot and ankle conditions, all the other things that we do here. So thank you all for watching.